I designed and conducted the nutritious snack intervention that was presented to homeschool students ranging in age from 6 to 16. This program was designed to help prevent childhood obesity through teaching students to make nutritious snack choices. Up to a quarter of a child's daily calories can come from snack foods. In this particular evaluation, we are trying to determine if the intervention program was delivered effectively, if it's worth the time and cost to students and parents, and if the intervention led to an improvement in those students' knowledge as well as behavior. There are several stakeholders. First of all, the education staff. It's important to see if changes need to be made based on the evaluation. The most important stakeholder in this case is likely the target population, the parents and the students themselves. Parents are most interested in their children being healthy. They want to see behavior changes in a positive way. And they need to determine whether or not it's worth taking time out of their schedule and out of their classes to bring their students to this intervention. In my logic model, I took a look at several activities such as identifying risk factors of becoming obese, brainstorming a list of what constitutes a nutritious snack, as well as identifying USDA Smart Snack guidelines. Finally, students were able to choose healthy snacks and explain the reasoning behind their choices. These activities would then consist of or produce several outputs, impacts, and outcomes, including increased knowledge, changes in behavior, and long-term health benefits. When evaluating the program delivery portion of the intervention, there are several things we have to look at. We have to look at the activities. Did the learning activities address the health concerns that were identified in the needs assessment? Were those activities taught as they were designed? Are the critical components being delivered well across all the classes? Are the resources being used efficiently? Were the funds spent on the specific snacks they were supposed to be spent on? And finally, to what extent were all of the activities, all of the modules provided to the actual audience? Were all the materials designed actually used? When we're looking at the program outcomes for our evaluation, we have to look at improvement of knowledge of nutrition as well as the actual practice. Are students improving on their nutrition knowledge as measured by the nutrition questionnaire at baseline and at intervention completion? Are they decreasing the number of sugar-sweetened beverages they intake? Is there a statistically significant number of participants remaining in the normal BMI range? For this evaluation, we would use a pre-test, post-test study design. We would measure a knowledge questionnaire, food frequency questionnaire, as well as BMI measurements. The indicators of success, or our standards, in this case would be 35% of participants remaining in the normal BMI category at subsequent follow-ups, 60% of our participants achieving a 30% increase on their nutrition knowledge tool, as well as the adolescents assigned to this intervention consuming 25% fewer sugar-sweetened beverages than the general population. The statistical method that we would use to analyze the results would be logistical regression in order to determine the odds of the event, in this case, the intervention and the improved knowledge and behavior due to the exposure of the actual intervention. There would be a report to stakeholders, all of those involved, both the educational staff as well as parents and students, and a short brief to all members of the homeschool co-op, and this would allow the results to serve as advertisement for hopeful future participation in the program.